Hello again. We're still in conversation with Mirinda van Zyl, who survived cervical cancer, as well as oncologist Dr. Devan Moodley. Dr. Moodley, I'd like us to discuss chemotherapy and radiology. Are the two mutually exclusive, or do they work together?
Well, they do both. They work individually and they work together. For cervical cancer, the majority of women who receive therapy for cervical cancer receive radiation plus chemotherapy. And the chemotherapy that's given with the radiation is given as what we call chemosensitization, a radiosensitizer. So we give them chemotherapy to make the radiation that you get in that area work more effectively.
Ah, I see. Let's talk about your treatment when you had chemotherapy as well as radiation. What did that do to your body?
The thing with chemotherapy is every single week your symptoms are different. So the first week I thought, okay, this feels horrible, but you want to box everything. So you want to box every experience. So you think, okay, so that's what chemo feels like. And the next week it just hits you for a 6 because your symptoms are completely different. And I was just physically so depleted that making my bed was
a mission?
Near impossible. And I lost so much weight because I couldn't eat. I don't know if you know, but chemotherapy makes everything taste bitter, even water. And so even if you feel like you want to force yourself to eat and drink, it's really, really hard, you know. And the doctors tell you, please make sure that you eat. But it's tough.
Kind of difficult.
It's very difficult. So I lost a lot of weight, and when you've got no nutrition coming in, you know, your body struggles to fight this. It was really,
and it comes with
really
side
tough.
effects. What are some of yours?
Your whole body is sore. It feels almost like the worst hangover you've ever had. It really is. It's almost as if your bones are sore. You ache all over. You're nauseous, and in the first couple of weeks you don't throw up, so you've got this awful nausea, but you're not able to throw up, and then when you start throwing up, you can't stop. And the radiation, when they radiate your bowel area, unfortunately, there's diarrhea and there's all of that, so nothing stays in. You're running to the bathroom, you're either throwing up or there's diarrhea, and so because my treatment regimen was over a period of 6 weeks, I had chemo once a week for 5 weeks. That didn't give me enough time to recover from the last chemo, so I just basically the only reason I left home was for radiation.
Sure. Dr. Moodley, we've talked about best case scenarios when it comes to cervical cancer. Worst case scenario?
The horror stories are correct. In other words, there are patients who present very late, as you know, and that's part of Miranda's mission in life, is to make sure that women get caught early when they have these diseases so we can treat them. But the worst case scenario involves women presenting so late that they can't have surgery. The radiation they have is purely for symptom control. They get chemotherapy merely to palliate, in other words, to treat symptoms and to extend life. And basically you're dealing with a very palliative situation. In other words, to try and control their symptoms until they succumb to this disease.
Sure.
So the disease presents at both ends of the spectrum. The best part is to get the patients early, even better prevent it from happening. But unfortunately, all too often, particularly in the public or government sector, women present late. And when they present late, we can't offer them surgery. And we can't offer them what in essence is curative therapy.
Mirinda, what are you most grateful for?
Well, I'm grateful to be alive, and I'm thankful that I've had this experience so that I can help other women. Oh, that sounds like such a cliche. But I really am thankful.
It is what it is, yeah.
You don't realize what's important in life until something, you know, like this happens to you. And I realized how important people are and how important it is to have a good support structure, and how thankful and lucky I can be because of the people that supported me. So there's a lot to be thankful for.
Dr. Moodley, in terms of support for patients, let's talk to family members, let's talk to friends, let's talk to people who are aware of someone that is suffering from cancer.
Always. You know, I think the thing about cancer is, again, a cliche, let's talk about it. Don't hide it away. You need to talk about it. It doesn't need to consume you. You need to talk about it, but what you need to do is you need to accept that this is a real part of what we have to deal with in our day-to-day lives. It is common. The moment you get diagnosed with cancer, as I'm sure you found out, then you automatically, everybody knows somebody who has cancer. Until that point, you don't know it exists.
Sure.
So I think it's very important. Your support structure is vital. Family, friends, they can assist you, especially on those days where you can't get out of bed. You need somebody to come there and say, come, you need to eat something.
Yeah.
And she's right, everything tastes like cardboard.
Sure.
We don't eat because we have to. We eat because we want to. And those are the things we need. We need the people to help us through these difficult times. And support is vital.
May I say something
Sure.
about that? I find that as humans, we like being able to control the situation. And we're out of control when someone tells us that they have cancer. So what I found is that people want, they want to tell you that it's going to be okay, but it might not be okay.
Yeah.
And so they have all these platitudes, and they try and fill the silence, and it's more harmful than it does any good. So one friend came to me and said to me, how do you want me to love you? What do you want me to do for you? And I think that's the right way to handle someone who has cancer. Because then that cancer patient is able to say, this is what I need from you.
Yeah.
Instead of someone saying, you need to eat lemon and garlic,
Sure.
or you need to eat a lot of asparagus. Meantime, you can't even have toast. You know what I'm saying?
Yeah.
So, yeah.
Dr. Moodley, let's close the conversation with this. What do you look out for as a person, right? We often hear, don't sleep with your cell phone within just a few, just a stretch from you. Microwaves, flying, apparently also, there could be something there with taken to the skies.
Unfortunately, living is associated with risk. Okay? One of the things, everything we do, we find out a couple of years later, that's not good for you. That was bad for you. We shouldn't have done that. We shouldn't have done this. We can only take the information we have at present and make the best of it.
Yeah.
So there are a few simple rules. You need to live healthily. You need to stay away from cigarette smoking. Right? That's proven to be bad for you. You need to drink alcohol, but in very moderate quantities, not more than a unit a day.
Okay, so a glass a day?
A glass, depends how big the glass is,
Okay.
right? But a unit, one tot if you're having a spirit, a glass of wine, one a day. You can't save it up and have it in the weekend.
Okay.
It's one a day, so it's almost medicinal,
Okay.
right? We should exercise at least 20 minutes a day. If it's Monday to Friday, 30 minutes, okay? We should eat healthily. Try not eat processed foods. Try and eat normal food. And if you do all of those things, this is a wonderful thing. At a recent Congress, one of the guys stood up there, and it's an international meeting, and said, if he could package that into a pill, he could sell that pill for more than $1 million a month.
Yeah.
If you were to look at the beneficial effects of that. But we don't want to do the hard yards, right? We want a simple solution.
Quick rewards.
See, so we are at the end of all of this an instant gratification lot. And it's not like that. It's like we have to do the stuff if you want to reap the benefits.
In a nutshell, you're saying take responsibility for your life. Own it. Thank you very much to both my guests for joining us. Dr. Devan Moodley, oncologist and director, Campaign for Cancer. Happy birthday once again. Mirinda van Zyl, cervical cancer survivor. Thank you very much.